Welcome to Your Pet, Your Vet. Here, we have a new segment this week. I'm really excited. We're going to talk about some different types of veterinary care. We know we've talked about some conventional care already. We also do some alternative or complementary care. Today, we're going to talk about veterinary acupuncture. A lot of people don't realize it, but this is available for pets too. Most people realize that you can do acupuncture in people. Well, you know what? The same principles and science applies to pets. I should say art and science, perhaps. We have with us today Dr. Rende Barrett, who works with us here at Lake Chatooga Animal Hospital and also Tri-County Animal Clinic. And she is a certified veterinary acupuncturist with the International Veterinary Acupuncture Society. I got it right. And we have a patient here, also a patient and client. Linda Crandall is with us with her beloved pet Houdini. And Linda, how old is Houdini now?
He's almost 11.
He's almost 11. And we've known Houdini a long time, and he has some significant medical problems, and but fortunately acupuncture has been a big help to Houdini. And I'm going to turn this over to Dr. Barrett to explain how she does obtains some history, some information, and the acupuncture exam, if you will, and also the acupuncture treatment. So Dr. Barrett?
Hello. So Houdini's been coming to us now for a couple months. So typically, you know, he's more of a recheck appointment. If he was starting out, I would probably take more, a more thorough history. There's lots of questions that we ask, typically about personality types, and just certain things that kind of lead them to propensity to get in certain patterns of disease. So he's already been through kind of all of that, and what we've been treating Houdini for is he has a good bit of arthritis along his spine. So he has a fair amount of pain, and we give him acupuncture about once every 1 to 2 weeks. Alongside, he's taking normal, conventional medication as well as some Chinese herbs as well. So typically, I do any exam just like I do any normal physical exam in an exam room. I typically look at things a little bit differently in terms of I look at tongue color, pulse quality, especially femoral pulses, to kind of give me an idea of the animal in terms of whether they're the energy, how weak they are, and that certain things. So typically with Houdini, he has a fair amount of pain along his spine, as you can see, as I kind of palpate along. He
actually responded to that, didn't he?
Yeah. I would say that it's less than last time, but still more than I want. So, and that kind of tells me that and the way he's sitting, he's kind of hunched up and guarding. He's got his little legs tucked in, so he is a little painful today. So typically I just look him over, just like normal exam on him. He's usually a pretty good guy.
I think he thinks I hope as you can see, he is very easy to work with. And that goes a lot with being very, try not to scare a pet. That's the whole secret to do a successful exam, isn't it?
Exactly. And just looking at him, like his tongue it's a little pale today. It's normal pink, but it's a little pale and a little dry. So I know Ms. Crandall had mentioned that he's having a little bit of problems with his appetite, a couple of instances of vomiting, so we'll definitely address that today with acupuncture. I'll turn it around just a little bit.
So I'll be your vet assistant if you need
help. Okay. His pulses are pretty deep, which usually is associated with weakness, and as you get older, it's kind of what Chinese medicine terms deficient, so that kind of goes along a lot of his problems.
You're responding to that, isn't he?
Yeah, he definitely has some pain there. Quick listen. Right, so now I'm going to start his acupuncture. I'm going to feel along his spine like I've done. I usually feel for places with heat. Usually that corresponds to inflammation and pain. I'll put some needles there. he feels like he's got some right here, and that really does correspond with his spleen and stomach association points. So that makes sense as far as the appetite, the vomiting goes.
And I need to help or just to have a way.
He's good.
Here's the part that amazes me. I've had acupuncture before, and it's doesn't really hurt that much. So I think it's generally pretty non-invasive, don't you think?
Yeah, definitely. And he takes it perfectly. He's always been really good with. And these blue needles are
Tiny.
They're tiny, yeah. They're a half an inch. I think 36 is the gauge. So they typically are really easy on him. They're his favorite needle.
Oh, the green ones are a larger diameter?
They're the same length, but they're a larger gauge, a larger diameter. So those are spleen and stomach points, and he does have a little pain here. It's okay, baby.
It's okay, buddy. Is he in good position still?
Yeah, he's perfect.
Good. Good. That's a good boy.
And these are kidney association points. And kidney is usually when you have any sort of hind limb weakness or arthritis. In Chinese medicine, it's usually associated with the kidneys. Yeah. Even though, if based on blood work, kidneys are just fine. So
Right.
it's one of those differences
Between
Eastern and Western medicine.
Right.
This point here is just a great point. It's called Ba Wei, and that's right at the LS junction. So that's great for him because he has arthritis there. And these are extra points that's going to increase his, they're yang strengthening points.
What's that?
Yang is like energy, and it's usually heat, warmth, and he tends to be like a colder cat. He likes heat, likes the heater, the sunshine, that sort of thing. So these are all points I typically do in him. And usually to balance it out, because I'm back here, I'll do bladder 11 up here, the top of his spine to kind of draw the energy down. So.
Good.
And then I'll do a couple local hip points.
Although he's not having any signs of discomfort to me, you can't help but think of a pincushion, huh?
Exactly, yeah. Especially how he's sitting right now. The cats are good like that because they sit perfectly for a lot of these points, the way they just naturally sit.
Yeah.
So I just put all these, and then I'll do this other hip. This thing. And I'm going to add one here in his nose, and this is appetite.
Well, that's because he's not eating so well lately, is that right?
Yes, exactly. And it's called on shin. Sometimes it tickles a little bit.
It's actually a different looking needle.
Yeah, that's a smaller needle,
See?
just because he doesn't have much.
Yeah, I still remember the kitty cat you did for me that was not eating after several conventional efforts to get this little kitten to eat, and you did that, and the kitten ate within 5 minutes. So that made a believer out of me.
It's a great point. So that's all the points I typically do in Houdini when I see him, and I think that's good for him today. I don't want to do too many points for him.
How long do you leave the needles in?
I usually leave them in for 10 to 15 minutes.
Okay.
And as you can see, I feel like he's let the needles, once they're in, he's having less of a pain response already.
Yeah, it's amazing.
So he's feeling it. And he usually sits pretty still. He's typically not very, he's really easy to deal with.
I know sometimes you'll do an electrostim. How does that work?
Electrostim, it works the exact same way, except we use the needles that actually aren't coated with plastic on those. Because we put the needles in the same way, connect them to a device that actually produces a small frequency pulse there.
Right.
And that's usually for things that are very severe paralysis,
Right.
Completely down, and that kind of, gives them that extra stimulus for that. So you reserve those for those really bad ones, bad cases. So.
Well, hopefully Houdini won't need that.
Hopefully not.
Hopefully not.
Well, as Ms. Crandall explains, that Houdini usually responds very well to the
It's done
acupuncture.
extremely well.
And we're really pleased that we can offer this type of additional therapy because it doesn't involve drugs, it doesn't involve any kind of invasive procedure. And then pets can come back as needed based on how they respond, essentially.
Exactly.
So I encourage folks to give us a call, and we'll get Dr. Barrett can explain more to you. And I guess that's it for this episode of Your Pet, Your Vet. Thank you for tuning in, and we'll see you next week.